government service. So the new politics didn't last long then, they say. There was also a story in the Irish Independent yesterday from emergency doctors who said that up to 1,750 people could die in the health service because of the proposed changes in the government policy as put forward by Wicklow Minister for Health, Simon Harris. Simon Harris had this to say.
You know, health ministers come and health ministers go. The health service and the people of Ireland need to know that there's a certain direction of travel that the health service is going to go in, regardless of who the Minister for Health is and regardless of who's in government. We have a unique opportunity now with a very disparate Dáil and indeed with a minority government to ask opposition and government TDs to come together, listen to experts, listen to stakeholders, listen to patients, listen to staff on the front line who are the experts to try and identify, where possible, a consensus.
Right, let's go to our local Fianna Fáil TD, Pat Casey. Good morning, Pat.
Good morning, Declan. How are you?
Good morning to you. So you've all fallen out with Fine Gael already over the health service, yeah?
Well, I don't think there's any falling out here, but I think it is beginning to test new politics, if we do want to call it. And I suppose we have to be patient with this, in the sense that there is a period of trust that has to be built up. Whether we can build that trust up is a different question. And I think, you know, there's a lot of egos in Dáil and a lot of red kite flying. I think this was one of the red kite flyings, because in fairness to the Minister who I actually spoke to this morning, is fully supportive of the motion that's going to be put before the Dáil next week, which is the establishment of a committee to deal with the health service and to come up with a 10-year
And what about
strategy.
these trusts? We're talking about trusts and the hospital, rather like the NHS in Britain, where each hospital look after its own and have a budget and all that. And Fianna Fáil allegedly were shooting that down.
Yeah, and in fairness, we suppose, and listen, I probably shouldn't get into the details of it at this stage, because if we're going to a committee and it's going to be a consensus, all this will be trashed out at that level. But just in relation to establishing different trusts, we already have 7 hospital groups and 9 community healthcare organisations in place who are under the umbrella of the HSE. Now, it doesn't make sense, a country of our size, to break them up into individual trusts, have them competing with one another in relation to staff and recruitment of staff, having 16 negotiations on pay and pay scales. None of it really makes sense from a control point of view and from efficiencies of scales point of view. But listen, the whole purpose of new politics is to try and get consensus, which will have to work under the current arrangement. And in fairness to the Minister, has agreed that he will support this motion in relation to the establishment of this committee, which is a cross-party committee and has been signed by all the Fianna Fáil representatives in the Dáil, Labour, Social Democrats, Sinn Féin, and most of the independents have signed it as well. And in fairness, Simon has come out and said he's supportive of this. And let it work its way through as what's the best policy for the health service over the next 10 years. And this red kite flying by people, it's going to happen over and over again. And we have to be, secure in our own position that we have to just deal with these and move things on gradually.
So a committee sounds like things will be put out for, far and long, and unfortunately people will have to deal with the health service because they're ill and they'll be on their trolleys while all the politicians sit around in their committee wondering out what they're going to do. And then the emergency doctors, up to 1,750 people could die because of the proposals.
In fairness, this committee, the guidelines of the committee, I think, has been set out. I'm not too sure the exact wording of it, but I think it's a 9-month committee where it has to come back with a recommendation within a 9-month period. And in fairness to the working of the Dáil, it probably has to go to a committee to get a general consensus to bring it into the Dáil to get it agreed. Equally, if the government was to go off on its own and come up with its own policy and bring it before the Dáil in 6 months' time, sure, it would be defeated because it hasn't brought the rest of the members with it. And if we could get a strategy for health that's over a 10-year period, which I think everybody agrees we need to look at health on a long-term basis and outside of political parties, that, if we have to wait that 9 months to get what is right for the country to move it forward, well, it's worth waiting for that.
All right, so this headline anyway in the paper that says, Government at war with Fianna Fáil on the health service.
Yeah, there's no war at the moment. I think in relation to the interview I had with yourselves on Saturday morning, Peter Murtagh was there as well. And he clearly said that the media will now have a role to play in how the next Dáil works. And it will have to probably report more accurately and less sensation in relation to stories.
So this Daily Mail story is inaccurate?
Yes, as far as I know, yeah. I think there's no foundation. That's not to say somebody is flying a red kite in relation to these trusts, but we put down a motion before the Dáil next week in relation to establishing a committee. The Minister has come out and said that he's supportive of this committee and he will work with the opposition parties.
Right. Well, I doubt Jennifer Braid, the deputy political editor of the Daily Mail, made it all up, to be honest.
No, I'm not saying that. As I said earlier, there's a lot of egos in Leinster House and there's a lot of people likes to cause a bit of trouble and get a bit of PR out there, and that could be one of these red kites flying exercises that we do see. And it goes back to the core principle. It's going to take a while to build up trust. If we can build up trust, hopefully we can. But it's going to create a while to get that trust and that consensus working. All
right. Don't forget the patience. All right. Good man, Pat. Thanks very much indeed.
Thank you, Declan.
Okay, Pat Casey there, Fianna Fáil deputy. Simon Harris, we were hoping that he'd come on early in the week, but he's settling into his department and he's meeting all the staff and he's organising himself and getting his feet under the desk, so no doubt we'll talk to him sometime in the future about his policies. Anyway, 087 77 11 103 is our number.